taking time for your health. The African American Wellness Watch. Trusted information for us, by us. Dr. Mike LeNoir and other experts from around the country and around the world have the latest on how you and your family can get healthy and stay well. It's time for the African American Wellness Watch. Welcome to the Wellness Watch. I'm your moderator, George Strait. We're going to spend the next few minutes talking about a disease that's all too familiar to Black folk, Sickle Cell Disease. It used to be called sickle cell anemia. Sickle cell is a devastating disease causing painful crises, even death. About 100,000 Americans have sickle cell. The vast majority are Black. Progress in developing treatments and even cures for sickle cell has been painfully slow, but there is new hope. The Wellness Watch is honored to have a pioneer in sickle cell research and the developer of the first approved treatment for it, Dr. Griffin Rodgers. Welcome to the program, Dr. Rodgers.
Thank you for having me on your show.
Dr. Rodgers directs the National Institute of Diabetes, Digestive, and Kidney Diseases, the institute at the NIH that pursues the most compelling research to combat the nation's most debilitating and costly chronic diseases. Dr. Rodgers has led the NIDDK for 17 years and is one of only 2 African Americans to lead one of the 27 institutes and centers at the NIH. Again, Dr. Rodgers, it's an honor for us to have you on our program.
Thanks.
Of course, the pilot of the program is the president of the African American Wellness Project, Dr. Mike LeNoir. Mike?
Dr. Rodgers, welcome to our program. You have seen so many changes in the evaluation and management of sickle cell anemia. Talk to us a little bit about where we are today in terms of the evaluation and management of the disease.
Well, of course, and just a brief explanation for your listeners who may be less familiar with the disease. Sickle cell disease is a genetic condition in which those who inherit a particular gene for hemoglobin, and hemoglobin is that protein that causes our red blood cells to be red. A mutation exists in the gene for that called sickle globin, and sickle globin unfortunately has a tendency, if one inherits 2 copies of this gene, to cause those red blood cells to sickle in a sense. Once the red cells give up their oxygen in the circulation, that sickling or change in the shape of the cells or the ability for those cells to squeeze in the circulation cause obstruction of blood flow and lack of oxygen to vital tissues and organs throughout the body, and over time cause a gradual loss of tissue and organ function.
In people with sickle cell disease, their red blood cells become deformed, turning sickle-shaped. The bone marrow tries to make more red cells to make up for the loss, but can't keep up, causing anemia. Their new shape keeps them from moving properly through the body, and the misshapen cells can jam up and stick to the walls of the blood vessels. These clumps cut off oxygen to healthy tissue, delaying a child's normal growth and causing fatigue and extreme pain.
The most common, though, occurrence that presents people in the emergency room is this agonizing bouts of bone and joint pain, which had been previously called sickle cell crisis, now known as sickle cell vaso-occlusive events, which characteristically can last anywhere from a few minutes to a few hours to a few days, and even weeks in some subjects. And that's what sickle cell is about. It's common in the U.S. I think you mentioned 100,000 people. It's common in places in the Caribbean, South America, but it's also common in sub-Saharan Africa, in the Middle East, and also in India.
You know, when I first started in practice, the African American community took ownership over sickle cell anemia. I recently did a kind of a small survey in the Children's Hospital in Oakland, and I went from the 1st floor to the 5th floor asking the Black employees about sickle cell anemia, and they didn't know anything about it. Are we losing as an as a group, are we losing our control over, not control necessarily, but are we losing ownership over sickle cell anemia in the African American community?
Well, that's I'm surprised to hear that, because I have to say that Corey system, that is the Children's Hospital of Oakland Research Institute, has been for decades one of the pioneers in sickle cell disease research, particularly in children. So I guess, what you found in speaking with workers there may reflect sort of the general lack of knowledge about the condition. As it certainly isn't a condition that is covered in the news, not until very recently, as other diseases like cancer and Alzheimer's, for example. And so I think it's more of a lack of awareness than sort of giving away ownership of the condition.
Yeah, Dr. Pashinsky and I have worked together on
Yes.
a number of related projects.
Mhm.
Since we have our time is scarce, talk to us about the revolutionary new treatments for sickle cell anemia.
Well, it was the Nobel Prize winner, Linus Pauling, who back in 1949 published a very impressive paper in which he called sickle cell disease a genetic disease. It was later coined to be the first genetic disease, in which he was able to show what happens to that abnormal hemoglobin, that it has a different change when you measure it using very sophisticated biophysical tests. So that first genetic disease, it was of course assumed that if you understood a disease so carefully at a molecular and cellular basis, that it would just be a matter of time before this disease could be cured. Well, that's not the case. In fact, it was just in December of 2023 that the FDA approved 2 cell-based gene therapies to treat sickle cell disease in patients who are 12 and older. Although they work somewhat differently, both therapies provide an alternative hemoglobin gene that could either substitute or interfere with the effects of this sickle cell gene in terms of the developing red blood cells. This therapy uses the person's own hematopoietic stem cells. They're collected, modified, and then returned with a single dose infusion as part of a blood stem cell transplant. And over time, because the existing cells in the bone marrow have been removed by myeloablative conditioning, these modified cells return and provide the function of their previous stem cells. So this has really been a very revolutionary discovery and application to the first genetic disease.
So this sounds very complex, and it sounds also very expensive. So is this a treatment for everyone who has sickle cell?
Well, it is not. It is complicated, but there are many sites and academic centers throughout the country who are available to perform this testing. It is expensive, and the costs range somewhere between $2 million to $3 million presently. We're using one or the other of these cell-based gene therapies. There are other sort of precursors or predecessor approaches that might be used, including a bone marrow transplant or a hematopoietic stem cell transplant that is certainly not as costly, and it can offer a cure for many patients who have a sibling donor that completely matches their cells. Of course, this has been quite effective in children. In fact, one of the first effective therapies with using bone marrow transplant actually occurred in Oakland in a kid who unfortunately had both sickle cell disease and leukemia, and a transplant was used to cure the leukemia. And upon recovery, the person's not only was the leukemia gone, but also the sickle cell disease. So this is another form of therapy, which is certainly not as costly as these gene therapy approaches.
It's interesting you raised the issue of sickle cell disease was first quote unquote discovered as a genetic disease by Linus Pauling in the late 40s, but now we're 70, almost 80 years since then before you get a first effective cure. And there's been a lot of criticism about the lack of funding for sickle cell research, and that lack of funding sometimes has a racial component to it. Talk a little bit about those kinds of disparities.
Well, in terms of dollars for research, of course, if you had more, you could always do more. I think colleagues, not only here at the NIH, but in also places, are continually working through the research that we conduct and support to improve treatment of people with sickle cell disease and reach this point of a cure. And not only that, but making the cure scalable and affordable. NIH, for example, is funding clinical trials to test new advances in reducing chronic pain in people living with sickle cell disease, as well as researching possible personalized treatment approaches to sickle cell-associated pain. Our sister institute, the National Heart, Lung, and Blood Institute, launched the Cure Sickle Cell Anemia initiative back in 2018 to safely and effectively advance promising gene therapies aimed at cure for sickle cell disease. And more than 75% of sickle cell disease births worldwide actually occur in sub-Saharan Africa. Yet these are countries that often lack proper resources and strategies to manage the disease. And to this end, again, NHLBI has been supporting Sickle Cell in African Consortium to address infrastructure needs and implement local standard of care in the treatment. But again, with more, we can do more, and we can do more faster. And that's always been an issue that one has to wrestle with.
Yeah, one of the things that we've always faced here in the Bay Area is that we have tremendous services for children with sickle cell anemia.
Mm-hmm.
Once they get to be adults, the services basically disappear. Are we doing a better job nationally in providing support services for adults with sickle cell anemia?
Yeah, that transition point, I think, has been very important, that children generally as a group, there are places that are very much appropriate and have a more comprehensive approach. In the adults, it's not as great. Particularly, is this issue of the complications of sickle cell crisis pain in the emergency department. And this is what our sister institute and we have sort of been preaching, that in order to prepare for an emergency department visit, working with a sickle cell healthcare team, particularly adults, it's important to, work with your provider to make a plan that's available, to have your medical records available. During what now seems to be sort of an opioid epidemic that we have in the country, there are people in emergency rooms who typically provide episodic care for patients are more reluctant than ever to prescribe powerful pain medicines for people. So having a plan, having your doctor's plan available, having your doctor's contact information, your medical appointments, what medications you're on, test results available, can sometimes smooth this out. I would say not only sickle cell patients, but also cancer patients who present to the emergency rooms have suffered most, as a result of this opioid crisis. But again, to answer your question specifically about wraparound or comprehensive services, there are certainly a number of centers across the country that offer this, but it's really not generally the case.
So, Dr. Rodgers, thanks for joining the program again. And I know that there's an awful lot of more information available to folks who, if they go to your website, tell us a little bit about what they could find when they go to NIDDK.gov.
Sure. Well, to learn more about the research we're doing in sickle cell disease and other diseases, as well as what our sister institutes are doing, I would like to, recommend your listeners or viewers to visit our website at niddk.nih.gov, or they can follow us on social media at niddk.gov for the latest updates in this and other areas.
Dr. Mike?
All right. Well, thank you once again, Dr. Rodgers. This is a very important issue, and I think that it's information our audience must have. So I want to thank those of you who've taken the time to join us. And as we always end, I'm almost embarrassed to say, but it's important. Health is your biggest asset, so protect it.